Hi folks, so one of the references you'll notice in the class, one of the links that I have, is to the LADC Chapter 9, which is the Code of Ethics associated with your licensure. And I just thought it would be helpful to spend a few minutes to actually go through these as they're part of our discussion this week, and also because I think it will frame the conversation as it relates to the other two articles which I've posted for our conversation this week. So the Code of Ethics that the Bureau of Licensure, Professional Licensure has adopted are here. And the first two seem pretty straightforward, right? Respect for the rights and dignity of persons of each client. The second one, make timely referrals to other healthcare professionals as it may be appropriate. You probably have a sense that that one may be difficult depending on the kind of work that you're doing and the people that you're actually working with. Number three gets a little bit more dicey, right? Terminate the counseling relationship when it is or should be reasonably clear to the counselor and the clinical supervisor the client's not benefiting from it. I think in the work that you do, that is often difficult. A lot of people, go through recovery or even in prevention stuff, and it's kind of in fits and starts. It's not always a straight line that people recover at the same level. The fourth one seems pretty straightforward. Depending on the work that you do. 5, 6, and 7 seem a little bit difficult. I really want to focus on number 6 for a minute. And we'll ask, I will ask you a question and discussion questions for you to really report out on this. What do you think that means? Avoid making unrealistic promises to clients or creating unrealistic expectations. It will be interesting to see how you interpret that and what your thoughts are for our discussions later on, and specifically when you share some case statement about a case, which we'll be doing later in the week, as I mentioned. The other one that I just wanted to touch on, and again, you have this as a reference in the resources section. I wanted to talk a bit about the number 9, which is protect the welfare and dignity of clients participating in research and obtaining informed consent. What are your thoughts on that? Is that something that is easy to do? Is it does it require a different level of release, or is it something that you can do with the work that you do just with people in general? Meaning that they sign a release and you can use that for study purposes. And secondly, when you think of it as study purposes, does that also include using like evaluation on how somebody's doing? So if you want to go back and look and see how they've done over the course of the time that you've been working together, does that include a study, or is that something different? And the other one I wanted to talk briefly about is number 12, not to use the counseling relationship to promote personal gain or profit of the agency or commercial enterprise. I think that one is pretty self-explanatory. It might, I think that one's pretty self-explanatory. But anyway, so these are the Code of Ethics points here, and we'll see in a discussion. I'm going to ask you to kind of pick one of these and talk about how you see that, how you struggle with that, and what are some of the challenges you have in working with that with the clients that you work with.